What if I told you that cancer could be the best thing that ever happened to you? I'm Joelle Kaufman, and after 4 decades of cancer experience across 3 generations of my family, I've learned something most people won't tell you about this disease. Right now, as you're listening to this, someone just heard the words, "You have cancer," for the first time. In the next hour, 230 more people will join them. But here's what nobody tells you about that moment. It's not the end of your story. It's a beginning. It's a beginning of discovering just how powerful you really are and just how innovative treatment has become. Welcome to Kicking Cancer's Ass, the podcast where we explore how life's curveballs become catalysts for connection, power, and joy. Each episode brings you insightful interviews with leading innovators transforming cancer care and people whose lives are transformed by their cancer journey. You'll be motivated, you'll be inspired, you'll be amazed. This is where all of us, whether we are facing cancer or not, rewrite the narrative from victim to victor, from surviving to thriving, one curveball at a time. Remember, you're stronger than you think, and you are definitely not alone. Today, I'm thrilled to welcome Sheila Mikhail, a remarkable entrepreneur who's making waves not just in biotech, but in women's health advocacy. Sheila co-founded AskBio, which was acquired by Bayer for over $4 billion. And after her own bilateral breast cancer was repeatedly misdiagnosed, she founded BC Ruckus, named after an oncologist told her she was creating a ruckus, my kind of gal, and demanding better screening. Now, she's fighting for legislation to ensure women with dense breasts get life-saving supplemental screening. Sheila, it is my honor to welcome you to Kicking Cancer's Ass.
Well, thank you so much for inviting me.
Of course. So let's start at the beginning. Tell us about your breast cancer journey and how being repeatedly misdiagnosed led you to create BC Ruckus.
Sure. So I went every year, like most women, to get my mammogram. I was always told that I was at low risk for getting breast cancer. I'm thin, I eat well, I don't smoke, I don't drink, I exercise, and there's no family history. So I was always assured that I didn't need to worry about it, but still, I went because it was just the right thing to do. I had my last mammogram early in 2022. In November of that year, I came out of the shower, I noticed a slight indent, like it was really so minor on my left breast. And my first thought was, well, I just turned 56. It's cellulite, and it's really horrible getting older. Even your boobs get cellulite. But I talked to my daughter, and she said, Mom, maybe you should get that checked out. Breast cancer was the furthest thing from my mind, to basically, calm her fears and, just to make sure. I went in. And I had a diagnostic mammogram at one of the best institutions in North Carolina. And they mammogrammed the left side and the right side. And they didn't see much on the left-hand side, but they were a little alarmed by that small indentation on the left-hand side. So they said, okay, let's do an ultrasound. They did an ultrasound. They saw something that looked suspicious, and they also saw something that looked suspicious in my lymph node on the left-hand side. So they said, well, we're going to go ahead and do an ultrasound-guided biopsy. They did it, and it took a while. It took 10 days for it to come back, and when it came back, they said I had a large tumor, and it's all a bunch of numbers and letters when you get your biopsy report. So I sat down and I tried to figure out what it was, and it was slow growing. And so that really set off alarms because I just had a mammogram earlier in the year, which was perfectly clear. I didn't have any indication of any problems. And when I sat down with the oncologist, I said, how do you know, right, that I don't have breast cancer on the right-hand side? I didn't expect that I had breast cancer on the right-hand side. People always tell you to look for lumps. My breasts, because they were dense, were very lumpy. They were like bags of marble. So I really didn't feel anything new. But to say look for the lumps, it was sort of, I mean, literally, my breasts are lumpy. And she told me, well, she goes, these 3D Tomosynthesis mammograms, they're incredible. I keep hearing that over and over, right? All the years that I went to my primary care physician, and I had breast exams too, done twice a year. But I always heard, oh, these 3D tomosynthesis are great. They're meant for people like you that have heterogeneously dense breasts. If you had extremely dense breasts, then we'd be concerned. But most women have dense breasts, and you just have a little bit dense. So these are meant for you, these machines. And the oncologist started off saying the same thing, and I'm like, look, clearly they're not so great because they missed this very sizable, almost 3-centimeter tumor on my left-hand side. I said, I want something more. I want some kind of additional screening to make sure there aren't any other tumors and to make sure that I don't have any cancer on the right-hand side. And I got, well, it's not the standard of care, right? I really got a lot of pushback. And I said, well, I don't care. I want something else. And I didn't know at the time because AI isn't as good then as it is today. Today I can ask my phone and it gives me more relevant information. There's a lot more stuff about dense breast screening. But in 2002, I didn't know what to ask for. I said, look, I don't know if it's an X-ray, if it's a PET scan, CT scan, MRI. I had no clue. I said, I just want something more. And then I got, insurance isn't going to pay for it. And I said, I don't care. And then I got, it's going to cost you $1,200. I said, fine, here's my credit card. And that's when she said, you're starting to really create a ruckus. And I said, it's my life. Let's say I'm just totally paranoid, right? Because I just got diagnosed with breast cancer and I'm just a little emotional, but I want additional screening. Well, I had the screening a few weeks later and it came back with an even larger tumor that was missed on my right-hand side. And it was so funny because they asked me to go back down to mammography, and the radiologist, who had done my initial screening at the time when I was diagnosed with breast cancer on the left-hand side, after they did the biopsy on the right-hand side for the second tumor, he took me into a separate room and he showed me the mammogram image that I had done when I first came in to get a diagnosis. And he said, see, it's not my fault. See, there's nothing there. But that didn't make me feel any better, right? I felt like I was in a horror show.
Exactly.
It's like nobody knew what they were doing. I since went back to Duke. That's where I got my screening done after I got treated. And I said, how do we make this better for other women? How do we make sure that, we find breast cancer timely? Because women are doing the right thing. They're showing up, right? We're doing our part, but yet we're not getting the right test. And it was interesting because I was basically told, well, it was my fault because I hadn't demanded from the beginning in all my screenings for the supplemental screening, and I didn't even know what to ask for, right? And even when I had cancer and I pushed, I had a hard time getting it. So I decided that it's really important, number one, that women are educated about what they need because the burden really lies on them. And number two, even after women are educated and they know they need supplemental screening, they get so much pushback. So they really have to have all the facts in hand and they have to be really armed and insistent on it. In our state, in North Carolina, insurance does not cover the supplemental screening. I think there's now a total of 37 states that do mandate that insurance covers the supplemental screening for women with dense tissue. But in my state, that's not the case. And women continue to have difficulty getting that supplemental screening, even when they ask for it. They almost have to be really insistent on it. And it's really problematic. We are told overwhelmingly in our state that the 3D mammograms are fine. They work great. But now there's evidence that's not the case. A recent trial, the BRAID study, and there's so many trials that have indicated that supplemental screening, misses a lot of tumors, up to 50% of tumors in women with dense tissue. So you need either an ultrasound or a breast MRI to be assured that you don't have breast cancer. But it's still a fight. It's still a fight in states in particular where insurance does not cover that additional screening.
And your breast cancer was particularly hard to detect because it was lobular, if I remember
That's
properly?
correct. So lobular doesn't create any lump. So even though I had lumpy breasts, my breast cancer wasn't contributing to the lumps. So lobular is almost like, I've been told, it's a bunch of cells that sort of line up, almost like cars in a traffic jam. So it's more linear, and then after it gets bigger, almost like a spider web, then it starts to get that hard mass. But in the initial stages, it's harder to see on a mammogram. It was no problem. When they did the breast MRI, it showed up very clearly. If I had only had breast MRIs earlier, I was diagnosed at stage 2. Thank God it wasn't more, or later stage. But if I had gotten access to the breast MRI, it would have shown up years earlier.
Yeah, I tell people often I actually feel lucky that I'm in the BRCA1 community because we do get intensive screening because we know, and at an 80% lifetime probability of breast cancer, they were looking with a cadence because it was almost a when, not an if.
I think that's really important for BRCA2 people to know that they have the gene mutation. I'm surprised that a lot of people don't know. They find out later in life, which, really talk about playing Russian roulette. I found out that I did not have BRCA2 because I did 23andMe, and that was one of the things they tested for. It should be more readily available, right? That's something like genetic screening, especially for things like BRCA2. I mean,
or BRCA1.
Or BRCA1 or BRCA2. It just seems like
right.
That should be something that should be part of standard testing, right? I mean, for 23andMe, I just spit in the tube and they could tell. It wasn't that complicated of a test. And it was part of a battery of tests that I paid, I think, $139 for. So it's not cost prohibitive to test women to see if they have the gene.
Interestingly, Dr. Esserman talks about, it's still the vast majority of breast cancers have no genetic, but the Wisdom study, which she is the leader of, but the Wisdom study is about personalized screening and genetic testing and ensuring that different women with heterogeneously dense breasts versus women with non-dense breasts, women with family history, women with genetics, like we're unique, and our medicine, our screening needs to match what's unique about us.
Yes, I agree. We're treated too much. It's like mass production. It's almost like we get in the McDonald's of healthcare instead of something that is more individualized and more thoughtful, right? It's just mass produced and we're mass processed rather than looking at us as individuals. And that's very unfortunate.
It is. If we are getting McDonald's version of healthcare, we're paying for it at the French Laundry level.
Oh, that's true.
So let's talk about, I love the name. You advocated for North Carolina's Save More Tatas Act. Now, I want you to tell people why you chose that name, and please share what the legislation is trying to accomplish and why it matters and how people can help.
The legislation got the name because when I went into the state legislature, North Carolina, to talk about breast cancer screening, the need, right, for insurance to be expanded to cover these supplemental tests, I was told by many of the male members of the legislature not to use the word breast because it made them feel uncomfortable. How do you talk about breast cancer without using the word breast, right? Do we say booby cancer? It's bizarre. But if they don't want to listen because they're turned off by the word breast, then, we have to address that, right? Because unfortunately, in my state, just like many other states, we have to convince men about a women's health issue. And it's important that they hear us. And so we came up with tatas instead. And our bill, Save More Tatas, was introduced by Senator Sidney Batch, and she is also a breast cancer survivor. And unfortunately, that bill did not pass this year. In North Carolina, we will not have any bills that will address better breast cancer screening in our state. It's very unfortunate. We have a very strong insurance company lobbying group, and they think it's too expensive to cover a supplemental screening. I think that's misguided because there have been studies done by Medicaid. In fact, Medicaid in North Carolina covers supplemental screening for women with dense tissue. And the reason for that is because they did the economic analysis, and there's a big jump in treatment costs between a stage 2 diagnosis and a stage 3 diagnosis. It's over $100,000 per patient. It's probably more than that because the study is a bit dated. And so if you can get more patients diagnosed where the cancer is more localized rather than having it regional or metastatic, you can significantly reduce the cost of care. So earlier stage diagnosis means less treatment costs, pretty common sense. And so that's why, again, Medicaid covers it. And it's about, in the study that they did, they said about 2/3 of women are diagnosed with an earlier stage, diagnosis stage 1 or 2, but there's a 1/3 of the women are diagnosed with those later stages, 3 and 4. So it's really about how many of those latter third can we get into earlier stage diagnosis. But that's just looking at treatment costs. It doesn't take into account all the other costs associated with a later stage diagnosis. As you know, if you have a later stage diagnosis, treatment is much more extensive and harsh on a woman, meaning that she may be out of the workforce for a longer time period. A later stage diagnosis means that a woman's more likely to have a double mastectomy, and a double mastectomy usually involves multiple surgeries, especially with reconstruction, and that means a lot of recovery time. Taking women out of the workforce often has detrimental impacts on their own financial state, but also on their families. So there are many studies that show that later stage diagnoses often result in increased number of bankruptcies. So and later stage diagnosis also means you get more out-of-pocket costs that you have to cover in addition to being out of work. It's extremely detrimental to have a later stage diagnosis. There are other papers that show that if a woman gets a stage 3 diagnosis, that there's a higher likelihood than the other stage 1 or stage 2 diagnosis. There's a higher likelihood that she's never going to return back to work. And these tests are not that expensive, right? Getting an abbreviated breast MRI, which there's a Journal of American Medical Association publication that says an abbreviated breast MRI is just as good as a full MRI in detecting breast cancer. And abbreviated breast MRIs are now available to women for around $400 out-of-pocket costs. So that's at the higher end. An ultrasound, which isn't quite as good as a breast MRI in detecting earlier stage cancers, but still it's better than a 3D mammogram. Ultrasound is about $150 to $180. So we're not talking these absurd costs. We're talking really pretty marginal costs for increased survival for a woman, right? Earlier breast cancer diagnosis means better chance of beating cancer. In fact, if you have a stage 1 diagnosis, it's almost 100% curable. And if you have a stage 4 diagnosis at the other end of the spectrum, there is a 75% chance you won't be here in 5 years. So it's life and death, right? And a few $100s to give a woman a better chance at life seems to me like a pretty good economic investment. But it's also about morbidity, the quality of her life. If she can avoid multiple rounds of chemo, multiple rounds or the minimum rounds of radiation, she can avoid a double mastectomy and getting reconstruction. I mean, why wouldn't we want that? The few $100 investment is really worth it. It's so absurd. I mean, it's just ridiculous. I can't even believe that we're still debating this. And there's so many studies now that make it very unequivocal that 3D mammograms are not adequate for dense tissue. They're just not adequate. There's a good chance they're not going to find your breast cancer, right? We're talking about up to 50% of tumors are missed in women with dense tissue. 50% of us have dense tissue. That's a lot of people affected, and that's a really high probability of a miss. Would you get on a plane if you knew that TSA missed 50% of bombs? You would not. But yet a woman is expected to get these 3D mammograms and be satisfied with it. And I would say it's even worse in some instances than having no screening at all, because you walk away with this sense of false assurance that everything is okay. You may be more vigilant if you hadn't had the negative mammogram report than you are with you being told repeatedly everything's okay.
Yeah, well, and I think it's amazing that 37 states agree with you and 13 states don't. And, you know, I wonder if there will be liability cases against those insurance companies for denying a screening that resulted in a later stage, because you're right, it makes complete economic sense. It's just not, it's not that expensive. And beyond, yes, they have trouble working, but often women are primary caregivers. So a woman with an advanced stage, we're talking about impact on children, on families, on workplaces. There's a big ripple effect. And who wouldn't want, I mean, look, early detection is everything. Until we know how to prevent this disease, which we don't yet, until we know how to prevent it, early detection is the most efficient way to minimize the societal and personal costs of breast cancer.
Absolutely. And I have to tell you, I still feel, and many women like me, I've met many women who, like me, showed up for our mammograms, relied on the advice of our doctors, right, from top medical institutions. We feel really betrayed because they took away our ability, our right to have an earlier diagnosis. They made decisions for us by telling us that 3D mammograms are fine. They would work for us, not to worry about it. If there's any issue, the radiologist will call you back and you'll have additional tests. By doing that, right, and not saying, hey, there's this additional test, it may cost you a few $100s. Are you willing to invest in this additional test, right? Maybe that means you can't buy that plasma TV this month. Would you be willing to do that? They took that option away. We're treated like, I don't know, you don't have the right to spend your money in order to make sure that your health is okay. That seems like, I don't know, it's just so demoralizing in how women are perceived by our healthcare system. I mean, to this day, I think that's the thing that upsets me so much. I asked repeatedly my primary care physician and my GYN, do I need anything more? And I kept getting these assurances that 3D mammograms, they will find cancer the size of the head of a pin. That was not the case. I had a total of 6 centimeters of breast cancer that went undetected. I mean...
So if it makes you feel any better, and it may not, but I was on the other side, right? I was screened constantly. One of the things I tell a story that I'd see my general practitioner. I saw him because I had a weird clicking in my elbow, and he's like, take off your shirt. I'm like, what does that have to do with my elbow? And he says, nothing. You're never coming in my office without a breast exam. So I don't care if you have an ear infection. So I was screened, I was touched. When I was diagnosed, I had an MRI 6 months prior. So the gold standard, right? Full bilateral MRI. And I remember when Dr. Chen and Dr. Esserman are looking at the MRI from January and June, and I hear them go, wow, check that out. And Dr. Peter Kuhn, who we both know, also knows the story. June, nothing. Mm-hmm. January, stage 2. Now, mine was smaller, 9 millimeter, and mine was ductal, and mine was hyperaggressive as opposed to slow growing. So the cancers are all different, but your point that not only do women have to advocate, but I think that we also have to make sure women understand cancer treatment screening is a massive area of research and growth, which we're all thankful for.
Yes.
The probability that your GYN or your primary is state-of-the-art current on it is 0.
Yes.
It's simply 0. So I'm sure when they went to medical school, they were taught, or they did their residency, 3D mammograms, awesome. Dr. Borofsky, on the episode that she's on, spoke about we're now doing mammograms with contrast.
Yes.
Now, I don't know if that would have helped with your type. With my
It
type,
would. It would.
right. So now we have another, and this can be your standard mammogram.
Yes.
Mammogram with contrast. Contrast is cheap. You know what lights up under contrast? Tumors.
Right.
These are cost-effective approaches, but your OB, that's why Dr. Borofsky recommends, and I'm sure you did this, so this isn't a critique of you, but for women who are listening or people who are listening, you want to go to a American College of Radiologists accredited breast screening center.
Yes.
And then start asking for, can I have a mammogram with contrast?
Yes.
Because the contrast is cheap.
But I would say in states where there is no insurance coverage, it's harder to get that additional screening.
Totally.
Even with contrast. Insurance coverage really dictates medical practices, unfortunately, not science.
Which is crazy.
And in fact, there's a paper that demonstrates this very clearly when it comes to, you can tell I read a lot of papers, when it comes to, because I think there's nothing better than evidence, right? So if there are people out there who are studying practices and they're determining why certain things are happening, I think I put a lot of credibility in that, rather than just anecdotal. What was my experience? What was your experience? But there's a paper that looked at medical practice for supplemental screening for women with dense tissue between North Carolina and New Jersey. And this was right after both states had the breast density notification law go into effect. So North Carolina had our law go into effect back in 2014. Mm-hmm. Right? So we knew we had dense breasts. And we went and we talked to our doctors about it, and like many women are just told 3D mammograms, don't worry about it, right? They're perfect. They are designed for your dense breasts. And in fact, I was told, and many other women are told, you are getting supplemental screening. You're getting something beyond the 2D mammogram. Oh. You're getting digital breast tomosynthesis. So it was almost like that, who's on first, right? It was a sleight of language. I was always told I was getting my supplemental screening. Mm-hmm. In any event, this paper did an analysis between the experiences of women in North Carolina versus the experiences of women in New Jersey after the breast density notification laws went into place in both states. And what they found is in North Carolina, women were more frequently referred for 3D tomosynthesis, 3D mammograms, but in New Jersey, women were more frequently referred for breast MRIs. And the authors concluded that the difference between the two states was that in New Jersey, insurance covered the breast MRIs, and in North Carolina, they did not. Insurance only covered the 3D tomosynthesis.
How do we expand on your movement? I'm having a whole Lysistrata movement, right? Like, oh, you're uncomfortable with breasts? We'll just take them away from you until you cover their screening. That's not really what they were for. So, it worked in ancient Greece. But what can we do? For those of you who don't know what Lysistrata is, it's a famous Greek play about women withholding sex until they got what they wanted. So what can we do? What can people do around the country, around the world, both locally, but also for this movement that you're so right?
So a few things. One, educate yourself. So first, protect yourself. Make sure you're getting the supplemental screening. And in North Carolina, I actually paid to have little cards made up in banners about the need for supplemental screening, and we mailed them to all of the breast imaging centers in North Carolina and asked the managers of those centers to put the cards out on the tables in the waiting rooms and put up the banners. And I distribute flyers through churches and everything else, really get out the message so that women can advocate for themselves. That's number one. And there's a lot of good information out there on the web, breastdense-info.com, My Density Matters. You can print the flyers and go in, have information available to really sort of fight, right, to get this additional screening. So that's number one. Number two, know what to ask for. It's not only just ask for the supplemental screening, know specifically what to ask for. A lot of women think that an ultrasound is enough. It may or may not be. It finds like 2 to 3 additional tumors per 1,000 women screened. In contrast, a contrast-enhanced mammo, which is not readily available, right? They're just starting to get rolled out here, or a breast MRI, they'll find up to 12 to 14 missed tumors per 1,000 women screened. So if you want the gold standard, it's not an ultrasound. It really is the contrast-enhanced mammo or the breast MRI. And the problem, too, with the ultrasound is there's 2 different types. There's one where they're automated, and then there's one that depends on the skill of the technician. The skill of the technician is not as good. It's just not as consistent. An automated one appears, right, to have better outcome. But again, if I had to do it over, I would have asked for a breast MRI or a contrast enhanced mammo, and that's what I do now in my surveillance. Every 6 months I go and I make sure I get one of the 2 of those to make sure that I don't have cancer at this point in time. There's no recurrence.
Did you have a bilateral mastectomy?
I did not. I had double. Well, that's the other thing I wanted to mention. In the event you get diagnosed, I got pushed because I had bilateral. I was really pushed to get a double mastectomy, and to me that just made a lot of sense. And I signed up for that, right? Until somebody who worked for me, I have the luxury of having run biotech companies, and so I have many doctors who work for me. Unfortunately, not in cancer, in the breast health area, but still they're pretty educated. And one came up to me and said, double mastectomies are what we used to do commonly, but these days we're really trying to conserve the breast as much as possible, doctors. So you should investigate a double lumpectomy. And when I did the research on it, the survival for people who have a double mastectomy versus a double lumpectomy is like marginal difference. It's like 2 to 3 absolute percentage points better for a double mastectomy, but it's a lot more involved, right? There's a lot of side effects and multiple surgeries, and those surgeries themselves have some potential consequences. So I was able to get a double lumpectomy, and I'm very happy with my outcome. And even if you have a double mastectomy, it doesn't mean that you won't have a recurrence. Some women get a double mastectomy and they still have a recurrence of breast cancer. So it's a personalized decision. The thing is, it's really hard because you'll be in shock when you get the diagnosis, and then the doctors are looking to you to make the decision, and you have no education about this. And I have to say that was probably one of the most stressful points in my life. Getting a double mastectomy because I had double tumors was very complicated. They basically had to do an outline of where the tumors were underneath ultrasounds and multiple biopsies. It was quite painful, and it took me about 2 months to have all the preoperative work done before I actually had my breast cancer removed. And because I had slower growing tumors, I was able to, the luxury of having that time, but still your mind goes crazy when you're waiting 2 months knowing that you have cancer inside you growing.
Let's pause there a second, because I think that's a thing people get confused about. Like, I had a very aggressive, fast growing, and I still didn't have surgery. I was diagnosed on Jan 9. I didn't have surgery till May 4th. Because No, it was good.
Yeah.
In my case, and again, this is where you have to talk to an oncologist, because Sheila, you and I we've effectively had different diseases.
Yes.
Right? So I had arthritis and you have asthma. Let's compare treatment plans.
Right.
Like, that's craziness. Yeah. So it's the same thing. But, for me, they recommended doing the chemo and using how the tumor was responding to chemo to decide how much more chemo I needed and how aggressive. So it actually prevented me from needing the most toxic chemo, because we saw that my tumor had fully responded to the less toxic chemo. So I consider that a win.
Yes, absolutely.
Right? And then because I'm BRCA1,
yes.
It was, you're going to have I was already planning to have a prophylactic bilateral, so it was a decision I'd already wrestled with.
Right.
And for me, the surgery was no big deal. The recovery was actually no big deal.
Yes.
And I did the reconstruction concurrent.
Yes.
With the surgery. So I think your point that's so valid is You have time to ask questions. You have time to gather data from other parties and to
Yes,
explore. You have time to craft this to be the solution that fits you. And
absolutely.
and the anxiety, oh my God, I have a cancer and it's growing inside me. If it has to come out immediately, your doctors are going to tell you that.
Right.
And breast cancer, Dr. Esserman says, it's only urgent because you know about it.
Yes. Yeah.
Like, we have to take care of it, but it's not actually an emergency. You have the time to do what you did, Sheila. Ask some people, change the approach, do all that preoperative work so that you got the least invasive and most successful for you.
Tailored for you. I think that, and your cancer,
That's
I
right.
think that's absolutely right. But it's important to get at least 2 and maybe 3 opinions, because my first doctor basically said, no choice in the matter. You must have a double mastectomy. The size of the tumors, they said there was no way to take them out. The second doctor said, I think I can do it, but I'm going to try it one time. And if I don't have clean margins, then you'll have to have a second surgery for double mastectomy. And I used to be quite a bit larger, but I'm very happy, right? It just, I'm happy with what my choice was and the outcome. Now, that doesn't mean I might not get a recurrence later, but I might have anyway, even with the double mastectomy. There's just a lot of education
Yeah.
that you have to undertake very quickly when you're not in the right emotional state. It was surprising to me time and time again where like I had to do a lot of research, right? And it was like I was going through my pathology reports. I didn't want to read my pathology reports. They're scary as can be. And
Right.
I'm learning about, well, I have this lobular breast cancer. What does that mean? Like all these things. I have ER, PR. There's all this nomenclature that comes at you very quickly, HER2 negative. But the treatment is substantially different depending on whether you have hormone positive or negative or HER2 negative or positive. And then, 2, I had to push for genetic testing. That was not something that was automatic, again, because insurance did not cover it. It was something that I insisted on, right? And so this is, in many states, this is not something that is part of the
Standard
medical
of care.
practice.
Yeah.
Well, for me, it was like, okay, my first thing was common sense. I'm new to this whole breast cancer regime. I had very little information, but common sense. If I have it in both breasts, maybe I have a genetic basis for it, right? So I did all this testing, and even then you get back this information that says, well, it may be of significance. It's unknown, right? Unknown
Right.
significance.
Right. May have genetic link unknown because we don't know everything yet.
We
No, I mean,
don't
the
know
point that
everything.
you went through, when I wrote the book, right, I wrote it as a playbook for the newly diagnosed
Yes.
because that moment when someone, and it's random, unexpected, arbitrary. In your case, you had no symptoms. I couldn't feel it. We're just like, what? And that moment, the world stops spinning.
Yeah.
And you are suddenly, I call it, you're thrust into an amusement park that's the worst amusement park in the world, Cancerland.
Right.
And no one wants to spend time there, and there's no map. And so I tried to create a map to give people a bit of comfort, a bit of hope, and a bit of space because this cancer is a plot device for entertainment.
Yeah.
So we all think cancer, I have to move faster, I'm going to die.
Yeah.
There are cancers like that. Your doctor will tell you if you have one, and it usually comes with, you have leukemia, you need to be in the hospital tomorrow for treatment. Right? Like it's like that. If they say it came back positive, we have to get you an appointment, we'll have to get you to an oncologist, that's signaling like you have to do something, but you can breathe.
Yeah. Yeah. Yeah.
You can breathe. And so take the breath.
Yeah. It's hard though.
It's so hard.
It's so
Yeah. I mean, Sheila, I was telling people over and over again how lucky people are like, what do you mean lucky? Like, I've seen this multiple times, and I told people I don't need a support group. I was born into one, and they all lived.
Yeah, yeah. Well, I think most people, though, when they get the diagnosis, they automatically go to the worst place. I know
Of
I did.
course. Of course you
Because
did.
breast cancer did not run in my family, and all I knew about breast cancer is what I saw on TV, and it's always a melodramatic thing where the mom got breast cancer and she died and she leave the kids behind, right?
And it's fast. And
It's
she
really
died and she's
fast.
gone. Like, that's what I mean by a plot device. And I can appreciate, A, there are situations where that happens and it's horrible.
Yes,
B, the frequency of that is much less frequent than the proportion that it shows up in movies, TV, and books.
right, right. Yeah. But I would say one thing that I did find disheartening. There wasn't a lot of empathy, at least in my experience. I did not get a lot of empathy from my doctors. I really didn't. I felt the system was overwhelmed. It wouldn't be atypical. I remember waiting to see a surgeon, and I waited like 3 hours in the waiting room. It's like, I think the system right now is overtaxed after COVID, and people are just too rushed to give you the time of day. They don't take into account, like, how are you doing mentally? It's really like it's mass production, right? There's a whole waiting room of people who have been diagnosed. It seems to me that more of us are getting diagnosed. I mean, I was 56, I'm not that young, but when I was going through my radiation in the waiting rooms and whatnot, there were a lot of women there in their 40s.
And younger.
Yeah, and with children and whatnot. But it just doesn't seem like, I don't know, I felt like I was very alone and sort of, don't ask questions, I don't have time, let's go. I felt always rushed, and I went through depression. I have to say, I had depression and I had a lot of anxiety when I was going through treatment. I felt very isolated and sort of at odds, right? I mean, it started off fighting to get the screening that saved my life. And so I really did not appreciate that. And I think that's one thing that people sort of have to understand. And I don't think my situation is unique. I've heard this from many people. You're sick, you've just been diagnosed with cancer, it's a huge blow, but yet you've almost got to suit up and be ready to fight. I had to
That's what we
fight.
call it.
Sorry?
That's my family calls it putting on our armor.
Yeah, I had to fight to get my radiation scheduled. I had to fight, right, to get my surgery done, and then they had a shortage at the hospital, so they pushed it back a week. And I was like, you have a date in mind, and then when it gets pushed back a week, yeah, I mean, it's not.
I hear you.
That's the thing I think that surprised me a lot. I mean, that just really sort of shocked me. I thought there would be more empathy, more support, just a little bit more kindness.
Yeah, I think there's this balance between keeping their own emotional health and being there. Did anyone recommend to you like psycho-oncology or some sort of mental health support for what you were going through?
Yeah, I mean, I actually reached out at one point and said, hey, I think I need to talk to, I don't know, psychologist, a therapist or whatever. And I started taking medication, and that screwed me up so much. I mean, that's not so simple either.
Nope.
Lexapro I tried, and that made me more anxious. I tried something else, and that kept me up all night. So I got off the medications, and there's no quick fix, right? And I think the whole therapy thing didn't really work either. I doubled down, right? I was a Catholic, and I doubled down on religion. That was the only thing that made sense for me. Went to
That
a
brought you
Christian
peace.
church. Yeah, and it brought me a sense of clarity and peace, right? But
Yeah.
I have to say that was one thing to this date that I don't know, maybe I shouldn't have been so surprised by, but I felt more like I didn't feel like a person. I didn't feel like I was being seen as a person.
I think that's important for people in the medical community to know. Like, it doesn't take much,
No.
right? It takes, and I didn't have that experience. I also didn't have the level of anxiety because I had such patterns of successful outcomes that I could latch onto. Like my mental model was this is a damn inconvenience,
Yeah.
but that's it.
Yeah.
Right? I mean, my mother's a 43-year survivor. Like it's a very different mindset. And not many people are going to have that mindset.
No.
So realizing that people are scared,
Yeah.
people want to know, and you can't say it's going to be okay because we don't know. I don't know what's
Right.
going to happen when you drive home.
Right.
But you can say, like, what are your questions? What are your concerns? I mean, one of the best lines I asked Dr. Esserman in my first appointment, so what stage do you think I am?
Yeah.
And she looked at me, she says, who cares? I said, excuse me? She said, all that matters is if your tumor responds to treatment.
Oh, that's nice. Yeah.
Right? And I was like, oh. And she goes, and that we'll be checking all along the way
Yeah.
to know how your tumor's responding. And if it doesn't respond the way we want, here's the next options.
Right.
And I really appreciate it. I mean, it wasn't a hug. It wasn't a,
Right.
I did not feel condescended to. I felt like a partner.
Yeah. I think that's important. Yeah. I think I started off on the wrong foot because, again, right?
You were angry. You were
Well,
really angry too.
and I had to fight to get the screen.
Yeah.
So there was a lot of mistrust, right? I was told from the beginning, don't worry, these tests are going to find your cancer. It didn't. And then it was like, don't worry, you only have breast cancer on the left-hand side. You're crazy to think you might have the right. And then I had it on the right.
I will say, and again, like I'm like in the world's like global services for screening. And
Yes.
when I had my bilateral, they did find a tumor in the other side.
Wow.
And I'd gone through chemo,
Yeah, that's
right? Like
Yeah.
these are stubborn diseases. But all right, let me do a quick rapid fire. And before I do, I want to ask, like, it was 2022. You're obviously a phenomenal advocate, fighting a great fight on behalf of all women, and I think everyone should thank you. How did having cancer change you, if at all?
Yeah, I mean, it absolutely changed me. I don't put up with like BS as much as I used to, right? I've run companies, right? My last company, I was employee number one. I built it to about 1,000 people operating in 5 different countries, sold it to Bayer, continued to run it as an independent subsidiary of Bayer, and then was diagnosed with cancer. And I didn't have chemo. Chemo doesn't really work on lobular, so I didn't have that. And I had 66 radiation treatments, right? So in the middle of radiation, I was really tired and I had to give up being the CEO of my company, which was quite devastating, right? Company I built over 20 some years. But it really, I think, sort of put in perspective, like what's important, what's not important. And I've started companies since, and I'm just much less tolerant of a lot of things that I used to just sort of grin and bear. It's sort of like, I don't tolerate when people waste my time over nonsense, right? If it's important, if it's material, then great. But it's just, I don't know, a lot of times in organizations, people spend time they get so focused on little petty things, and you're like, really? I face like life and death, right? This is not something that I am going to allow you to waste my very valuable time on. I think you become very cognizant of the fact that there's only so many grains in the hourglass. I mean, I felt great most of my life. I thought I was physically fit, and I was always running really hard. So I don't think I was as stingy maybe with my time. And now I'm sort of, I don't like to waste it on nonsense. I really don't. I want to be focused with my time. I want to use it for maximum impact. I still want to change the world. I've always worked on diseases that affect children. All right, that's been my career for 25 years, developing drugs for rare diseases that primarily affect children. And now I still want to do that, and I want to do it with focus and maximum impact, but I also want to change women's health, because I think it's actually easier. It takes hundreds of millions of dollars and a decade, right, to bring a drug to treat some kind of rare disease. We can save women's lives by just giving them access to the right screening for their breast type. Mammograms work well for 50% of women who have fatty breasts. But for the rest of us, let us get access to the right tool so we can find our breast cancer early. And by doing that, right, I can have a bigger impact than I could have had in the last 20 years on developing drugs for sick kids. So, yeah.
Oh, that's awesome, Sheila. That I think many women will owe their lives to your advocacy, and you're bringing visibility to this.
Well, I ask everybody to join in the effort. There's legislation pending in Congress, the Find It Early Act. You know, this is the third year that we've been pushing for its passage. It's tough. Write your state senator and in particular the Senate to let them know that this is something that's important. If you live in a Republican state where you have a state senator or your representative is Republican, even more important to write them. And, you know, it's economically rational and it can save a lot of lives.
Outstanding. All right, let's do the rapid fire. By the way, I'll put a link to the Find It Early Act. And if you're deeply involved with that, something in the Jewish community, we've gotten pretty good at making it very easy with the Action Network to just push a button and it fills in all the blanks of who you need to be talking to and sends the letter. So I did not see that on the Find It Early website. So you can easily find the name of your representative and your senator and send the letter, and you should. Everyone should. This isn't a women's health issue. This is a human issue. Last I checked, all men came from a woman.
Yes.
And most men are fond of women in some way or another. So we want to keep people healthy. And Sheila, I do want to correct something you said. You were healthy even when you had cancer, right? You were not suddenly an infirm, sick person. You were a healthy person with cells that had run amok.
I like that mindset. I like that a lot.
Good.
I think that's an important way of thinking about things. I really do.
Yeah. So, all right, rapid fire. What does kicking cancer's ass mean to you personally?
Overcoming. The word overcoming.
Fantastic. What's one thing about breast cancer that you wish everyone knew?
Get supplemental screening if you have dense tissue.
Amen. Amen. Okay. Best advice for women newly diagnosed with breast cancer.
Sorry? Say again.
Best advice for women newly diagnosed with breast cancer.
Get informed.
If you could change one thing, I know what the answer is, about our healthcare system overnight, what would it be?
Insurance not being so stupid about things.
No kidding. No kidding. What gives you the most hope for the future of cancer care?
37 states have seen the light. 13 more to go, and it will change, right? There's so much information coming out now, so many studies being done. It's overwhelming evidence that women with dense tissue need supplemental screening. So it's just a matter of time, and every woman in America will get it, and insurance will cover it.
And in the meanwhile, all the women, we need to be making noise. We need to be advocating. We need to be asking for it. If we have dense breast tissue, we need to be asking, what's the right screening for me?
Exactly. Personalized medicine. All of our boobs are not the same.
No, they're not. Nothing in our bodies are identical.
Yeah.
So, Sheila, I really want to thank you for sharing your story, your vulnerability, your righteous fury, which is fully justified, and for continuing to create a ruckus. Is there anywhere you'd tell listeners to go to learn more about your work and to your advocacy work? Is there a link they should go to?
Well, we have a website, BC Ruckus, but what I would say even more importantly, go to our partners, My Density Matters and densebreast-info.com. They have more comprehensive websites, and we work in conjunction with both of those organizations. There's also Liz Powell, an individual lobbyist, and she's also taken up an effort. She has breast cancer screening advocacy lobbying effort that's underway, and a whole bunch of us are going to be up in Congress next month trying to really advocate for the passage of the Find It Early Act. So a lot of people are getting involved in this effort, and hopefully, right, this year we can get it passed.
I wanted to add one other thing that changed since you've had cancer.
The other thing that's changed is I focus more on today and now. I always used to be planning for the future, and I still, plan for the future, like a vacation trip or spending time with loved ones, but I spend a lot more time appreciating everything that's around me and really being immersed in the feelings and the environment and just being more conscious and aware of all the good things that are here now. And I try not to focus on bad things that could happen in the future. And every time my mind starts racing about reoccurrence or Oh, even death, right? I just keep bringing it like, hey, right now it's happy and it's good, and let's see all the good things, right? So truly like smelling the roses, taking time to smell the roses, it became much more of a practice than it did before.
It also sounds like you have a lot of gratitude for like I
Oh,
said, the sun coming up. The sun coming
absolutely.
up, I am thankful. Love it, love the
Absolutely.
feeling of it.
Well, I think that goes also to not sweating, right? The little
Right.
things and really not being drugged down by petty things anymore. You really look at the materiality of something as like, that's not worth spending my hours of my time glass on. That's something that's just not worth it. Refocus.
I also found that with people. Like
Yeah.
there are people that I want to spend time with, and then there are people who I'm like,
Yeah. Yep. And you get more stingy. In the past, you might have felt guilty and you may have spent time with them just to avoid, right, being perceived as, not being a nice person. It's okay not to always be nice.
okay, and on that, I think we'll call that a wrap. It's okay not to always be nice, particularly if you need supplemental screening. Don't be nice.
Absolutely.
Be demanding.
Be very demanding. It's okay. It's okay if
Awesome.
your doctor says you're creating a ruckus. Create a ruckus and save your
Go for
life.
it. Amen.
Amen.
All right.
All right. Thank you so much.